My name is Oleta Garrett Fitzgerald, and I am from the Children's Defense Fund and the Southern Rural Black Women's Initiative for Economic and Social Justice. This is the most consequential election that we faced in the state of Mississippi in the governor's races that are coming up on November 7th. And we are encouraging everybody in our community to get out and vote. Many times people ask us, why is it important for me to vote? I don't think my vote matters. We have been crossing the state of Mississippi. We are doing 7 regional meetings in every corner of the state, in every region of the state of Mississippi, to try to get people to understand that if their families lack access to health care, that this is a really important election. There are many families in our state, over 300,000 people, who fall through the gap between being able to afford private health insurance and accessing Medicaid. In the state of Mississippi, only children and senior citizens and pregnant women are primarily eligible for Medicaid. That leaves in the gap many working families who work hard every day at jobs that sometimes impact their health. And even if those jobs offer private health insurance, they don't make enough money to be able to purchase it. This is especially true for people who work on jobs like CNAs, maintenance workers in hospitals, people who come closest to disease but yet can't afford private health insurance, and their health is at risk. This is true for children who's in the state, the Mississippi Delta, where the only NICU unit in that region closed this year. Children who are suffering from illnesses as a result of a troubled pregnancy, having to travel 2.5 hours to be able to get to a NICU unit. So these are critical times that people's lives are at risk. Mississippi has the highest rate of maternal and infant mortality, yet people do not have access to emergency care. We are told by researchers at Jackson State University that 80% of the women who die early in childbirth and maternal deaths could be saved. 80% of those women could live if they had had access to critical health care. Another issue facing the state that is of critical importance is the number of people who don't have access to emergency assistance when they struggle, when they lose a job, or when their jobs don't pay them enough money to live. This is true of families that are eligible for the TANF program. We've heard a great deal about the TANF debacle and theft that took place in this state. Yet we don't understand that in a state of 3 million people, that there are only 3,000 people who are on the welfare rolls in the state of Mississippi. And most of those are children-only cases. This is according to information that comes from the State Department of Human Services. Mississippi receives a block grant from the federal government of about $96 million a year for the TANF program. That money sits there and it is prone for patronage usage because there's nobody on the welfare rolls. And a third of that money could go toward helping families struggling, trying to pay for childcare so that they can go to work or stay at work. About $30 million could be transferred from that TANF block grant into child care assistance for working families. Another issue is one of broadband expansion. Mississippi has received an appropriation in grant money from the federal government of $1.2 billion, that's billion with a B, to expand broadband in rural areas and so that low-income families can have access. The decision on where that $1.2 billion in federal grant money will be spent will be made by the governor's office. That will ensure whether or not our children can enter a 21st century economy and have the skills they need to function. Many people have some kind of broadband, but it does not allow them the bandwidth or the reliability to be able to use their broadband for the things that their families need. That was particularly true during COVID, when children had to go to school virtually, and the broadband that they had did not allow for more than one child to be going to school at the same time if they had 2 or 3 different classes in their home. So all of these are critical decisions. We have to be very careful and monitor what's going on with these resources. But all of the things that I have just talked about, the decision will lie in the hand of one person, and that will be who is the governor of the state of Mississippi. So on November 7th, let's go vote. Let's vote for our families. Let's vote to make sure that they have access to the health care that they deserve and need. Let's vote for struggling families in this state who don't make enough money to buy all of the things that their families need, including the high cost of childcare. And let's vote for our young people so that they have the technological skills that they will need to participate in a 21st century economy. Go vote, November 7th.